Hi, Lisa.
Hello, thank you for having me.
Before we delve into further on purpose, would love for you to have and to share your background and experience. And as you are sharing your experience, please talk about your purpose and how it has evolved.
Sure. Well, my background is I'm an occupational therapist, and I think I became an occupational therapist because of my purpose and what I wanted to achieve in my career. And that was really always about working with children and always about helping make a difference to people's lives and in a relationship-based way. And that sort of led me down the path of occupational therapy. And I started actually my clinical career in working with children with disabilities. And then I moved into child and adolescent mental health and actually worked at PMH for about 17 years in various programs, but particularly the eating disorders program. And the thing I loved about child and adolescent mental health, which sort of probably fitted with my purpose and helped me refine my purpose, was that although it was working in a big institution, which wasn't really what I was hoping to do, it was working with children from all walks of life. So people from very low socioeconomic areas, disadvantaged families, and families that had a lot of resources. So I like that social equity of it, which was always important to me in terms of my purpose. And as an occupational therapist, it was a fairly unique kind of role because you got to work with people over many, many years and really develop a relationship with them and become part of their life, which I think is a very privileged position.
Yeah.
But also it's through that relationship-based work that you can make the most difference and leads to the most change, in my belief. So that definitely fit my purpose. And then I found myself a single mum and very frustrated with the hospital system, felt a bit like a number in a huge organisation, a bit lost and increasingly frustrated with the amount of time spent doing meetings and sort of going around the same circles in terms of not actually being able to impact change at a bigger level than the individual level. So that led me to look for a not-for-profit, community-based organisation. And I found Kids Are Kids. So that was about 9 years ago, and started there as their program and clinical coordinator. And then the CEO left not long after I started, and I started acting in the CEO role with Teresa Barry, who was already working at Kids Are Kids as a general manager, and we've shared that position ever since. And yeah, that's a beautiful alignment to my purpose because I think it's working. Kids Are Kids is all about all children having access to therapy regardless of their background and circumstances, and that every child has the access to support to reach their best potential, basically, reach their full potential. So that definitely aligned with my purpose. And the organisation itself is very authentic, it's very values driven, and I think my values align with that, and that's why I fit in that role. And yeah, it's always been for Kids Are Kids about building relationships with families and working with them ideally over a long-term in a long-term manner, which makes a difference. So yeah.